Our patient is a 21-year-old Division I baseball pitcher who suffered from a grade 3 biceps tendon rupture and had to have a surgical reattachment. These exercises focus on stage 3 of the rehabilitation process.
The first exercise, you have the patient stand anterior to the trampoline, holding the ball just below the sternum. They then do chest passes to the trampoline and catch it, causing both concentric and eccentric contractions. This should be done for 3 sets of 10, and if easy, can be added with more weight. The next exercise we're going to do is internal and external rotation. Before you begin the exercise, you want to place a bolster underneath the elbow, in between the elbow and the torso. Then proceed with having the patient stand whichever size appropriate, throwing the ball internal 10 times and catching, and then standing the other way and throwing it external times for 3 sets of 10. The last exercise to complete before we can put him back into his return to play protocol is to have him do a pitching style throw. So he stands anterior to the trampoline, ball begins overhead, and he throws the ball and catches it and eccentrically slows the ball back into the original throwing position. They should do this exercise for 3 sets of 10 as well. Once they are able to do it on a light ball, a heavier ball may be used.
A really good exercise for strengthening the shoulder or rotator cuff muscles is using a ball against the wall. With this exercise, we're looking at balance and coordination. In this exercise, we want to make sure the ball is about shoulder height, the elbow fairly straight while applying compression, keeping the body parallel to the wall and keeping your core muscles tight. In this exercise, we don't want to retract the scapula, but keeping the shoulder in a neutral position. Then have the patient start by taking the ball through normal ranges of motion by going through superior, inferior, over to the left, then to the right, and back to neutral position for about 30 seconds. Here we are teaching the muscles to work properly, so we want the shoulder to work in different planes by placing the ball across the body, outside and above the head to enhance the mobility about 10 to 15 times. Then have the patient slowly progressing, starting by making small circles, going in a clockwise rotation while keeping the arm fairly straight, making sure they're activating the scapula throughout the exercise. Once you've done about 10 to 15 times for 3 sets, you can now move on to counterclockwise motion. You could even have the patient go through ABCs.
So with this next exercise, we're going to be using a weighted slosh pipe to really challenge the musculature surrounding the shoulder as well as the scapular stabilizers. So in the first exercise, you're going to be holding the slosh pipe and then you're going to have your arm out to 90 degrees of flexion. And then you're going to tilt the slosh pipe side to side as shown in the video so that you're getting the weights to move from one end to the other. With this exercise, it's really important to make sure that you're activating the core and co-contracting and making sure that you're really focusing on twisting the arm as one whole unit so that you're so that you're challenging mostly the shoulder versus the wrist with this exercise. You're going to do it for a total of 20 seconds and with 3 repetitions. In the next exercise, you're going to have the slosh pipe. It's going to be the same idea, but your arm's going to be out in horizontal abduction. And then you're going to be, same thing, contracting the abs, having the scapula retracted and nice and stable, and then you're going to be twisting your arm from the glenohumeral joint to get those weights to move side to side to work on strengthening those shoulder muscles, but in a different range of motion. With both of these first 2 exercises, you can progress them by being single leg or being on an Eric's pad. That way you're also challenging the balance aspects in your rehabilitation. For the final exercise, you're going to be incorporating that sport-specific movement. We have a baseball pitcher, so we want to get him moving through that movement and strengthening all those components. So you're going to have the pole, and you're going to move through that pitching motion at the same time while you're still tilting it back and forth to get the weights moving and to really be challenging the stabilizers of the shoulder. And simultaneously, you'll be working on the coordination of that throwing motion.
This next exercise is called rhythmic stabilization. The target muscles of this exercise are the muscles of the rotator cuff. The patient is laying supine on a table with their shoulder flexed to 90 degrees, elbow extended, and hand reaching as far towards the ceiling as possible. The patient will try to maintain this position as the clinician will apply forces to the arm in all directions, trying to move the patient from this position. In order to maintain this position, the patient will have to activate all the muscles of the rotator cuff group. Progression of this exercise could be having the patient add a weighted ball to their hand, going on all fours with their knees down, or on all fours with one leg up and one arm up, and trying to maintain that exact position, which would activate the core as well. For any of the previous mentioned progressions, the patient could also close their eyes, which would make things much more difficult as well. This exercise can be introduced at the very beginning of stage 3, and with its progressions can advance all the way through stage 3. The components of proprioception that this exercise addresses are balance and coordination.